Discerning Poverty, Not Simply a Matter of Income, by Maggie Gray and Ben Schaeffer.
The current means of both defining and measuring poverty are inadequate. After researching similarly developed industrial countries, we discovered that other nations, in addition to the U.S., struggle with defining and measuring poverty and its implications. However, our focus will primarily involve the current condition in the United States and how we propose to modify the current standards of defining and measuring poverty.
The outdated official poverty measure, OPM, used by the United States Census Bureau and the newly adopted supplemental poverty measure failed to accurately capture the complete picture of poverty in the United States. We propose a hybrid model that builds on the existing models but also considers capabilities, levels of poverty, and changes in consumption patterns of the average consumer unit in America. This proposal of a hybrid model would be a better tool for both defining and measuring poverty because it takes into consideration factors other than economic status. However, before we delve into the complexities of our argument about poverty in the United States, we must look further at the history of defining and measuring poverty.
In 1963, the Census Bureau created the official poverty measure. The OPM calculates poverty thresholds using 3 times the cost of a nutritious but low-cost diet in 1963, adjusted for inflation using the Consumer Price Index. Many academics, including John Iceland, a leading sociologist and demographer, criticized the OPM as an outdated measuring tool for poverty thresholds. In 2010, after 15 years of research by the National Academy of Sciences, the supplemental poverty measure was debuted as a more comprehensive way to measure poverty. To determine thresholds, the SPM calculates the amount of money spent on food, clothing, shelter, and utilities. These are considered the basic needs, but the SPM, unlike the OPM, acknowledges that households have other needs, so it appropriates an additional amount for other non-discretionary expenditures. In his 2003 book, Poverty in America, A Handbook, Iceland echoes these concerns by saying, "The current income definition does not take into account variation in expenses that are necessary to hold a job and to earn an income."
The OPM and SPM vary by more ways than how they determine their thresholds. How each method calculates resources affects who is considered to be in poverty, thus affecting what benefits these people receive. The OPM, roughly speaking, considers only income and cash benefits. The SPM considers all income, cash benefits, in addition to in-kind benefits, and subtracts expenses for other necessary goods and services that aren't accounted for in these thresholds.
The main problem with the current methods of measuring poverty is the binary nature of the systems. An individual is either in or out of poverty. Unfortunately, these methods do not account for different levels of poverty. There is a significant difference between someone that hovers right at the poverty line and a person that is $10,000 or more below this line. An additional problem results from the dependence on financial standing to determine one level of poverty. The current approach neither accounts for capabilities inadequacy nor poverty as social exclusion.
In Meyer and Wallace's Changing Poverty, Changing Policies analysis of OPM data from 2006, one realizes that the average person experiencing poverty would need about $8,113 to be above the poverty line. With the OPM thresholds, a person would just escape poverty with this sum of money and would still be experiencing a subpar standard of living. The graph provides greater clarity on the depth of poverty that people experience. It is not enough to say that 12.3% of the population in 2006 were experiencing poverty. One must consider how much variation in resources there is between those experiencing poverty.
In order to improve the lives of those in poverty, we need a better understanding of what poverty actually is. It is not the simple lack of economic resources. That is why we've improved upon traditional definitions to reflect a more holistic and representative approach to poverty. We define poverty as a state of deprivation that is caused by some combination of resource and capabilities inadequacy. Resource inadequacy is when an individual lacks the resources to live at an acceptable standard of living based on the Human Development Index. The resources that we considered include, but are not limited to, income, access to health care and education, childcare, and low-cost transportation. It is crucial that the dialogue on poverty also consider capabilities. An individual is experiencing a capabilities inadequacy when he or she does not have the ability to accomplish the functionings necessary to live life with an acceptable standard of living. When individuals suffer from inadequacies in capabilities, their functionings are severely limited. Elaborating upon the philosopher Martha Nussbaum's functionings are things that a person chooses to be or do as a result of the capabilities that they have.
Our model combines the existing FSCU needs with the new category titled Non-Discretionary Services. The major changes from the SPM model include a revised definition of utilities, which includes access to internet and the addition of specific categories that the SPM does not use explicitly. With more specific categories and an additional category for other non-discretionary spending, our measure of poverty can accurately demonstrate what people are lacking. The creation of discrete categories is important to understand where individuals are inadequate in certain areas. The education category refers to access to adequate elementary and secondary schooling. Individuals that do not have access to schooling are at a disadvantage. Without access to affordable transportation, how are individuals supposed to get from place to place? It is important to note that transportation is comparable to the average of a geographic area. We do not expect having a car to be a threshold for people living in New York City. The final two categories are access to affordable preventative and emergency healthcare services and affordable child care options when necessary, for example, when both parents are working. We also allow for a small apportionment of additional non-discretionary spending that does not overlap with the other newly created categories.
Now that we have introduced our new categories, we can look at the graphic produced by the Bureau of Labor Statistics. This graphic portrays the average annual expenditures for the average consumer unit of 2.5 people in 2009. With this visual in mind, we need to consider what is different about our categories from both the SPM and the OPM.
One of the changes that we propose is modifying the food definition. Under the OPM's use of the Thrifty Food Plan, someone meeting their threshold can have a nutritious but monotonous diet. But we believe to have a decent standard of living, a person should not be so limited. With our proposed use of the low-cost plan, they have the opportunity to insert some variety and maybe even some more expensive, healthier options into their diet. The current definitions of utilities include natural gas, electricity, fuel oil, other fuels, telephone services, cell phone services, water, and other public services. We believe that in today's society, those needs have expanded. We propose adding access to the internet because in today's technological world, internet access is very important. In terms of non-discretionary spending, we support the SPMs considering it, but we believe it needs to be more explicit. We've detailed the exact services that we believe need to be accounted for in determining poverty, and still included a broad non-discretionary spending section for any other necessities we may have failed to acknowledge. We are not proposing modifications to the categories of clothing or shelter. Now that we have explained the major differences between our proposal and the current measurements, we will look at our first attempt to update the poverty threshold.
We tried to redefine the poverty threshold as a level of spending proportional to the expenditures of the average consumer unit. We excluded the categories of tobacco, alcohol, and entertainment from our plan because these are not essential to an acceptable standard of living. By comparing the FDA's low-cost food plan with the average amount a consumer unit spends on food, according to the Bureau of Labor Statistics data, we discovered a 5.6% difference. We then used this information to create a low-cost lifestyle plan by reducing the average expenditures on each of the given categories by 5.6% as well. This plan resulted in consumer expenditures of $47,186.78. This number would be adjusted to account for differences in household composition and geography. While we had hoped to determine a new, more inclusive poverty threshold from this method, we realized that this number is not realistic. Not only did our new model come up with an unattainable and arbitrary threshold, it failed to consider capabilities.
Current discussions on poverty look at measurement through either an economic or capabilities lens. We agree that the consideration of capabilities is important, but the two views must be considered together. Unfortunately, many measures of poverty, including the OPM and the SPM, disregard capabilities and define poverty simply as a household having a certain amount of income. However, a more accurate measurement would incorporate both aspects.
We would like to build upon Martha Nussbaum's central capabilities, which serve as a starting point for understanding how capabilities relate to poverty. Of the 10 central capabilities she recognizes, we will highlight bodily health and affiliation, and explain why inadequacies in these categories represent poverty. Imagine an individual that is lacking in financial resources while simultaneously suffering from poor bodily health. This combination of resource inadequacy and capabilities inadequacy severely limits the functions and livelihood of an individual, qualifying them as in poverty. Now let us imagine another individual. This person suffers from an inadequacy of affiliation, being unable to participate in society without concerns of disrespect and discrimination. Without the ability to live a life with normal social interactions, she can be considered as poverty when you use the social exclusion definition. When an individual's affiliation is compromised, they are experiencing social exclusion and thus poverty. Now that we have reflected on the importance of capabilities, we will delve into our suggestions for modifying the poverty measurements to more accurately represent when a person should be considered impoverished.
A more comprehensive understanding of poverty incorporates the SPM, a substantial revision to the OPM. If the SPM was adjusted to become a non-binary system and specify exactly what sections of non-discretionary spending and services are important, it could be even better. One way to accomplish is the creation of degrees. For example, a person experiencing level 1 poverty would be an individual that is far below the poverty line. We would also include a category for those that are near poverty. While technically above the poverty threshold, they might drop below for any number of reasons. For example, changes in macroeconomic conditions or sudden short-term non-discretionary spending. In addition to these suggestions, we believe that capabilities and adequacy is a very important facet of poverty. The Human Development Report currently uses the Multidimensional Poverty Index to measure capabilities. The Multidimensional Poverty Index does this by looking at deprivations in the areas of education, health, and living standards. This analysis of non-monetary resources serves as an important tool for indicating a person's capabilities. Consideration of capabilities is a necessary component for a modern and holistic approach to poverty.
Our attempt at redefining poverty highlighted two important parts of this dialogue. There is a socio-cultural difference between a state of poverty and that of being poor. An individual who is resource and capabilities inadequate is experiencing poverty and is often, but not always, viewed as a poor person. However, a person who lives a modest lifestyle can also be considered poor by a relative societal standard, directly relating to social exclusion. There are a lot of factors to consider when thinking of poverty. Defining and measuring poverty is a complex process. It involves a wide range of people and ideas. A consideration of financial and physical resources, while giving thought to perceived social norms, are all small pieces of this puzzle. Macroeconomic institutions, governmental policies, stigmas, and stereotypes can, and often do, limit the discussion of poverty to merely money. It is more than that, and unfortunately, there is no current consensus on what poverty actually is. But that does not mean we should not strive to have a better understanding. We hope that our discussion on poverty will aid in the ever-growing and changing larger discussion on poverty and its relation to the United States.